What is first aid? First aid refers to the emergency or immediate care you should provide when a person is injured or ill until full medical treatment is available. For minor conditions, first aid care may be enough. For serious problems, first aid care should be continued until more advanced care becomes available. Before initiating first aid care, we must do proper hand washing and use personal protective gear. Hand washing is essential in the prevention of disease and illness. Wash your hands after each episode of care and after taking off gloves. When a sink is not available, use hand sanitizers. Most hand sanitizers are alcohol-based and are a substitute for hand washing when needed. Using personal protective gear is an important strategy to minimize the risk of blood and bodily fluids exposure. If the person is bleeding, always wear gloves and protective eyewear when giving first aid care. The universal precaution is to use personal protective equipment whenever there is possible exposure to blood or bodily fluids. It reduces the risk for both the rescuer and the injured ill person to be exposed to a blood-borne disease. The gloves protect your hands from exposure to blood and other bodily fluids, while eye protection prevents accidental exposure from splashing fluids. Consider also a pocket mask as a part of your personal protective gear as it provides safety during rescue breathing. Be sure to dispose of all equipment that has touched bodily fluids in a biohazard bag when available.
In the case of burn, if you accidentally poured or burned yourself on a hot substance, call for assistance. Then cool the affected area with cool running water as soon as possible for a minimum of 10 minutes. This will reduce the pain, swelling, and risk of scarring. Do not use ice or ice water. Next, cover the wound in cling film or a plastic bag to reduce pain. Do not burst any blisters. If the burn is severe, immediately call the emergency services.
If you find yourself in the right place at the right time, be prepared to save a life and follow these steps.